The report I'm releasing today tells the stories of dozens of courageous police officers from across Ontario. They are police officers who have put their well-being on the line for the people of this province and were injured in the line of duty. But because their injuries are mostly invisible, their stories are rarely talked about. Some of them were even fatally injured, but for them there are no memorials or large ceremonial funerals. Of course, I'm talking about police officers who have operational stress injuries because of the demands and trauma of their work. They battle every day with depression, anxiety, nightmare, addictions, and post-traumatic stress disorder. And on top of that, they battle a culture that tells them that they should suck it up and be strong. They battle a bureaucratic structure that's so behind the times that it doesn't have any idea of how many of them have this kind of injury or even how many of them have killed themselves. The Ontario Provincial Police and the Ministry of Community Safety and Correctional Services both say they take the issue of operational stress injury seriously. But my investigation shows they are failing, and the results are frankly tragic. My investigation reveals for the first time that 23 OPP officers have committed suicide since 1989, 2 more than have been killed on duty. La police provinciale de l'Ontario et le ministère de la Sécurité communautaire et des services correctionnels disent tous deux qu'ils prennent au sérieux le problème de blessures de stress opérationnel. Mais mon enquête montre qu'ils n'en font rien et que les résultats sont franchement tragiques. Elle révèle pour la première fois que 23 membres de l'OPP se sont suicidés depuis 1989, soit 2 de plus que ceux tués alors qu'ils étaient en service. This is the most extensive investigation my office has done, and the report is the largest we've ever produced. When we began our research, we were struck by the lack of information available, not just about what the OPP and the Ontario government were doing about operational stress injury among police, but what is being done about it throughout the police community. My hope is that this report will help police services, policymakers, and service providers further their understanding of the issue, promote best practices that are already in place in some police services, and eliminate the stigma that is at the core of the problem. J'espère que ce rapport aidera les services de police, les décideurs et les fournisseurs de services à mieux comprendre le problème, à promouvoir les pratiques exemplaires déjà en place dans certains services de police et à éliminer la stigmatisation qui est au cœur du problème. As many of you know, this topic is not new, nor is it new to me. When I released the first report on post-traumatic stress in the Canadian military in February of 2002, we saw many of the same issues of stigma and a culture of denial. The military had no idea how many soldiers were suffering from operational stress injury, and the war in Afghanistan was just beginning. That report woke up a lot of people, but there was also a great deal of backlash. A national columnist called it whining. A former general called my findings spurious allegations. The Canadian military was slow to recognize the existence of operational stress injury. But 10 years later, the culture of denial there is gone. In fact, as some people told us in this investigation, the Canadian military has often provided help to Ontario Police who have nowhere else to turn. If the military culture can evolve, I'm optimistic that police culture can too. But we certainly cannot afford to wait another 10 years. That is why I'm so concerned about the lack of substance in the OPP's and the ministry's responses to this report. The OPP and the ministry received my preliminary report in late August. The OPP had 5 weeks to review my recommendations. The Commissioner responded with little more than platitudes calling for OPP members, caring for OPP members. He made no concrete commitment to addressing any of the specific issues raised in this investigation. The Ministry's response was simply indifferent. It was only when they viewed the final report last week that both wrote letters indicating that they will respond to the recommendations after further study. The OPP Commissioner is setting up a working group, and the Ministry will have its staff study, quote, options, unquote, for responding and get back to me in 3 months. I've released their letters with my report. You can judge them for yourselves, but I remain disappointed by what still looks to me like a bureaucratic brush-off. My recommendations call on the OPP to do the very basic things that police services have been doing for years. Train officers and their families about dealing with trauma and preventing suicide. Make sure they have access to people who can help them. Keep data on operational stress injuries and suicides. This is about supporting the people who put their lives on the line in the most difficult kind of public service and keeping them healthy and functioning. It's hard to think of a better public investment. The Ministry could show leadership where the OPP has not and extend that leadership to help officers in municipal forces across the province. It needs to acknowledge that operational stress injury are a real threat to the health and wellness of our police, and it is in all our interests to support sensible, systemic solutions. I will keep a close eye on this issue, and I've asked the OPP Ministry to report back to me in 3 months. I'm also hopeful that whenever the legislature returns in a new session, this issue will find champions among all parties. Be happy to take your questions.
Do you know how many OPP officers may be suffering from these kinds of operational stress injuries?
I don't know, and most shockingly, the OPP has no clue. This is the first time that we were able to piece together the number of suicides being at 23, 2 more than officers killed in the line of duty since 1989. But there's no data out there. So whatever the OPP has to answer to will simply be rhetorical because they just don't know.
What are these injuries caused by? Is it, traumatic calls? I mean, maybe.
Well, the OPP gets called, for example, to scenes of carnage on our highways, to scenes of shooting. And it's the exposure either to one event or more than one event that causes these symptoms to arise. And unfortunately, in a paramilitary organization like the OPP, unless there is strong leadership in the organization to discourage a crass prejudice and appealing to the lowest common denominator, these things take their toll on the officers that have been exposed to these circumstances. My advice to the Commissioner is simple. Get down to brass tacks. Deal with the issue. Right now, so far, the OPP has dealt with it as if it was a public relations issue that they needed to manage. What we've heard from the OPP is a lot of clap, trap, and drivel, and very little action. And that I find very disconcerting.
You know that the OPP currently has trauma teams, they have critical incident teams. They are looking at the issue, they are dealing with it. Are you saying it's just not enough?
To call the way they deal with operational stress injury as a shoestring operation would be insulting to shoestrings. There's no coherent system of support from the beginning to the end. They have, for example, one staff psychologist whose primary duty is the screening and establishing of norms for recruits. It's not to deal with frontline officers. So I think the system fails. We looked in our report at 15 other jurisdictions from across North America. And the OPP is made up of over 8,000 members. It's a powerful, sophisticated organization, and it just fails to deliver when it comes to taking care of its own members.
Qu'est-ce que ça demande comme culture, comme cette apparente indifférence dans le traitement des suicidaires? Qu'est-ce que ça demande comme culture selon vous?
Ça demande, c'est une culture qui a besoin d'évoluer. En ce moment, l'OPP a une position insoutenable lorsqu'il y a trait à prendre soin de ses propres membres qui ont été exposés au stress opérationnel. Et puis, le stress opérationnel peut produire des blessures qui sont tout aussi importantes que des blessures physiques. Et puis, c'est quelque chose qui doit être pris au sérieux et ce n'est pas le cas en ce moment.
C'est de l'ignorance ou de la négligence?
C'est un peu des deux, un peu de négligence puis un peu d'ignorance. You know, we call it operational stress injury because psychological injury can be just as bad as any physical injury, but because you can't see it, it's easy to ignore. And that's part of the problem here in making the culture evolve.
You're calling this a bureaucratic brush off. What were you expecting from the OPP commissioner?
Well, let's put it this way. We made 34 recommendations. And if I may just pick a few random ones here. The OPP should develop and implement education, training, and outreach programs relating to OSI designed for family members and officers. Full stop. Couldn't they say yes to that? I mean, it's that you need a working group, months to decide whether or not you will implement such a recommendation. Recommendation number 4. The OPP should expand the use of peer presenters in its education and training efforts related to operational stress injury. What is there to study? Similarly, we made the recommendation to the Provincial Ministry of Community Safety and Correctional Services that they should require all police services in Ontario to provide information about the education, training, support services, or other measures they employ to address operational stress injuries and suicide prevention. Again, I ask, why the ostrich-like reaction of just putting your head in the sand? Can you not agree to implement this kind of recommendation? So these are not recommendations that require a great deal of study and a great deal of debate. These are very, very basic, elementary recommendations. Is it sufficient for the OPP to have one staff psychologist who's not even in charge of counseling officers with operational stress injury? I mean, this is an organization that's right now buying shiny tanks. There's 2 of them right now in the OPP service, one more than there is of psychologists in the service. So to me, when I talk about brush off, I mean simply they're dealing with it as a PR challenge as opposed to trying to solve an issue, and that's where the problem is.
Is this unique to the OPP, or how does it compare to, say, the Toronto Police Service in terms of how they handle this?
It's not unique to the OPP. The OPP is the only police service that I oversee with respect to this issue. But I want to say that as we started this investigation, we had very good cooperation from the Police Association of Ontario and the Ontario Provincial Police Association. And those of you who have followed my career will know that we're not often on the very same side of the issue, but we are in this case, and that should be very telling. One organization which has been very conspicuous by its silence is the Ontario Association of Chiefs of Police. We invited them to participate in the investigation, give them their side of the story, and they have been opinionless. How could you not want to contribute to this discussion? So I'm very concerned about the lack of leadership in the highest echelons of the police services in Ontario in dealing with OSI, which I think simply not only tells you it's the elephant in the room, but the silence is deafening, and it allows crass prejudice against people who suffer from OSI it allows it to flourish. And as long as it flourishes, we can't get rid of it.
But when you say there's no coordinated programs by the OPP to deal with post-traumatic stress disorder, for example, and you look at other police forces, do you see examples that you can point to? I mean, do these programs exist elsewhere?
Oh, absolutely. There's some programs that are more evolved than others, but I don't want, because I don't investigate those individual police services, I can't present to you a comparative study, but we have given you in the report, we've surveyed 15 different police services from North America and outlined some of the best practices out there. And the OPP being the largest, arguably most sophisticated police service in Ontario, is far from being a leader, and in fact, most likely is at the bottom of the barrel in dealing with OSI.
Est-ce que vous avez eu des réactions des familles de policiers qui se sont suicidés finalement?
On a eu une très bonne collaboration de la part des familles et aussi des policiers qui ont été exposés à des blessures qui sont dues au stress opérationnel. Très belle collaboration des associations de police en Ontario. Là où on a vu moins de collaboration, c'est auprès des chefs des services policiers en Ontario qui, eux, n'ont pas participé au débat. Écoutez, lorsqu'on parle de 23 policiers qui perdent la vie depuis 1989, 2 de plus qui ont perdu la vie lors d'interventions policières, qui sont décédés de suicide suite à l'exposition au stress opérationnel, c'est très sérieux. Et puis, j'aurais pensé que les chefs des services policiers auraient voulu contribuer au débat, et c'est malheureux qu'ils ne l'ont pas fait.
Mais comment se sentent les familles des victimes?
Ils se sentent très lésés, les familles des victimes. Ils se sentent découragés, abandonnés par le système. Et puis, dans plusieurs cas, ça l'accorde toute la famille. Et puis, donc, c'est pour ça que c'est important de traiter du problème de stress opérationnel et puis d'incorporer des solutions qui vont viser les familles, non seulement ceux qui ont survécu ou qui se sont suicidés.
What the families told you about dealing with officers who were in this position and failing to get the supports they needed?
The families are devastated. There's no doubt about it. It takes their toll. The operational stress injuries cause us tremendous amount of suffering. Suffering over many years. Suffering because of the trauma that the member goes through, and if that's a loved one, you will feel it as members of the family. So that's why a solution by the OPP must encompass a solution that offers the support to families. And that's the kind of solution that we won't want the Ministry of Community Safety and Correctional Services to incorporate as part of its mandate. But the Ministry, unfortunately, has basically abdicated its duty to set the tone for police services across the province.
And why do you think that is? Because we know when there's an officer who dies in the line of duty, thousands will come out. The officers support each other. It's not because they don't care. Yet many of these officers have been trained to take control of a situation, and obviously losing control would go against their feeling of losing control would go against their basic training. Many of these officers who are in charge now have been around for maybe 30 years, the senior levels, trained in that type of thought. I mean, what is the big stumbling block here in terms of just taking the initial steps in your view?
I saw it 10 years ago, the Canadian Forces. I see it right now with the OPP. It runs counter to the paramilitary culture of the organization. That's why we need to really break through that barrier. The military, it took the report that was issued 10 years ago. It meant follow-up. It meant media coverage. And I'm hoping that we are able to do the same thing here, break through that barrier. You know, I don't feel particularly comforted when the OPP says to me and the ministry says to me, it's better than it was 30 years ago. If it's better than it was 30 years ago, stop using the media lines from 30 years ago. It's unfortunate that that's the best they can say it's better than 30 years ago. I want to see good governance. I want to see the organization take care of its members. And it will not be able to get there unless there is strong leadership by action. It's not good enough to simply say, well, I'm there. It's not good enough to simply treat it as a PR challenge. So it'll require the commissioner to take some bold actions here.
In the course of this investigation, you said you spoke, or your office spoke to some police officers who'd gone through this. Can you give us an example of a police officer, what happened to that person and how they dealt with it and what ended up happening in the end?
Unfortunately, for 23 OPP officers since 1989, it's meant paying for operational stress injury through the ultimate sacrifice. But between the incidents that caused it and their death, many are out there suffering every day and having to deal with this wall of silence that's out there. And that's why I call on the Commissioner of the OPP today to break that wall of silence.
Why are suicides, in essence, covered up? There's never a media release. Data, like you said, data is so hard to come by. Is this, in effect, a cover-up? There could be more suicides that are unaccounted for?
I think that it's an organization which is very proud, and rightfully so, but when it comes to this issue, has a misplaced pride. Somehow there's a feeling of failure, of shame, and I think that's what we need to change. We need to recognize that an officer who commits suicide as a result to being exposed to operational stress is just as entitled to our support as someone who has died on the line of duty, because that officer has died on the line of duty, even though sometimes it's not exactly at the time of duty, but it is in the line of duty.
Can I just ask you about police officers who feel that they don't come forward because it'll be a career killer? I mean, how do they go if there's any emotional weakness or feeling of a psychological weakness that their career is over if they actually come forward?
No, that's why I have to tell you I'm extremely grateful to the courageous men and women of the OPP and indeed other municipal forces and services that have come forward to share with us what happened to them. And in many instances, we've had to anonymize their identity in order to protect them. And that shouldn't be the way it is, but it is the way it is, unfortunately. And so if you go out after my press conference today and interview senior police officers and they defend the system, ask them, why did the Ombudsman have to anonymize their identities, the identities of people who are suffering coming forward?
Do you believe that these officers would face backlash and perhaps demotion or any kind of discipline for coming forward?
In the current climate that exists right now in the OPP, the answer to that is yes. Thank you very much.